Having a baby is a joyful and exciting time for families. However, for some it can be a challenge. Women have regular physical health checks, but sometimes their mental health is forgotten, and many suffer in silence with conditions that are treatable. Women with mild or moderate mental illness can be helped by GPs, midwives and health visitors who should be trained in mental health. Some women will have severe or complex illnesses, requiring help from a specialist perinatal mental health team, either in the community or in a mother and baby unit, where they can be admitted with their baby.
After my husband and I had been married for a few years, we started talking about babies, and I think I'd always been quite wary of that. So my baby was born, and we brought our baby home, and he cried a lot, and I was starting to really struggle with being able to just function and being able to look after myself and my baby. And one night I was lying in bed, I was breastfeeding. He'd been feeding on and off for about 5 or 6 hours, and I was tired and I was sore, and I didn't rest and I didn't sleep. I just lay there and it felt endless. And I went to see the GP and I said, I can't rest because the baby is not settling. And he said, you're breastfeeding. There's nothing that I can do for you. I wasn't able to get that help, and that terrified me. To me, good care is about being heard and listened to, but I think it does also need to be a specialist service, because from my experience, when my friends and family were all milling around me doing things, it helped, but it didn't fix any of the core problems. They didn't have the expertise that I needed to actually help me address those core issues. I don't want a service that carves me up into different pieces and I have to see different people to deal with different pieces, because it's one life that I have and I'm one person.
The role of clinical psychologist is really important in helping the women to address some of those issues that might possibly have been the trigger for their symptomatology, which is treated by the psychiatrist. My particular work has been to use video feedback. We make a little video clip of the mother playing with her baby. The object is to give the mother confidence, to see the baby as a person. Of course, that's what gives us such pleasure when we see that a mother really is enjoying being with her baby. It's important to acknowledge the wealth of experience that a multidisciplinary team brings in working with women around the perinatal period. We have nurses and nursery nurses, occupational therapists and social workers, as well as psychiatrists and psychologists.
Yeah, I didn't realise that she had postnatal depression. I thought that sometimes she was just a bit stressed out or things were a bit hard having a baby. The first time I knew that she had postnatal depression was when I came home from work and she burst into tears and told me that she almost put herself under a train and she wanted to kill herself because she felt that she wasn't good enough for me or for our 2 children. Nobody understood. When I talked to my friends and I said, well, she's got postnatal depression, my friends would say, what's that? Just like I did at the start. But I ended up having my own struggle because I didn't have anybody to talk to. I don't think one person asked me how I was doing, in all honesty. I think that it would have been easier if we both had more support, obviously. Something more personal, you know, not like a leaflet or a brochure. And I think I've seen them before for postnatal depression, but it's just like an information leaflet. It doesn't offer any services, there was nothing. So hopefully I might be able to start a group with some dads.
I work in a specialist team which is integrated with the maternity service. Unfortunately, these services are rare and they're not accessible to all women. When we meet, we discuss the risk of becoming unwell in pregnancy or after delivery, and I help women to make decisions about using medication in pregnancy and breastfeeding. Women who are at high risk of becoming unwell have a pre-birth planning meeting. At this meeting, we make a comprehensive plan so that the woman gets the care and support she needs and knows what to expect during pregnancy and after her baby is born.
My interest in perinatal and mental health was particularly stimulated by a case of a patient who I knew very well. She developed postnatal depression. In the end, when her condition deteriorated, It was quite frustrating for me as a GP because there really wasn't much in terms of support apart from me. Looking at the commissioning angle, we need a lot of coordination between health and social care and housing. And we need to think about not just providing a specialist service for patients with severe perinatal mental health problems, but we need to be looking at a community service which can really help to support those women with the milder to moderate end of the spectrum. Having perinatal mental health leads in midwifery, in health visiting, in GP surgeries would be a way to ensure that when women do need extra support, there are clear pathways available, and be looking at prevention as well to make sure that we are promoting perinatal mental well-being and not just dealing with problems.
An excellent perinatal mental health service should span across a variety of professionals and services, including the voluntary sector organisations. We need to work together, integrating mental health and physical health care and developing innovative ways of working, keeping the woman and her family at the centre, ensuring they have access to the right care so they can give their children the best start in life.